of the facilities they make available for them. At this point, we are going to move into a question and answer section, and we do want to remind folks that you can type in questions by submitting those on the left-hand side of your screen. So give us just a moment here. We'll bring up some of the questions that have come in thus far. And Dr. Pope, our first question that was written in asks, what's the difference between this procedure and a breast reduction? So if you can speak to that for just a moment.
All right, well, a breast reduction is typically defined as reducing the size of breast in women, and it's done differently than this type of procedure in men. With women, you're taking away extra tissue, but you're saving enough tissue to create and form an appropriate sized breast. You're preserving the nipple areola on a vascular pedicle, and you're shaping a new breast that's going to be of a significant size, maybe A cup or B cup or C cup. Whereas with this, you're removing breast tissue. You want to get a flat chest appearance. So you're taking out tissue in a different way. Usually, there's not the problem with extra skin, but as I showed you a few minutes ago, in severe cases with a lot of extra skin, you have to be a little bit more radical, and that's almost similar to a breast reduction.
Very good. And we touched upon this a little bit earlier with the policy that you have in place relative to insurance that covers activities that might occur after the surgery. But if you could maybe talk to us about your experience and what patients should expect from their insurance that they currently have. And we've had some dialogues about the fact that most insurance companies do not cover this, but there's an initial outlay from the patient. But if you can talk more expertly to that, maybe Lisa, we turn to you to start us.
Okay. I've actually been in this field, the plastic surgery field, since 1989. I have never seen an insurance company approve this surgery, ever.
When I do see once again on gynecomastia.org, on that website, I see a number of young men from Canada and from Great Britain who maybe have it covered in their type of health care. In some rare cases I've seen Americans in the service maybe have the surgery covered, but it's pretty rare. I just don't see that here.
All right, very good. The next one we have from an individual who asks, is it easier or more effective to perform the surgery when you have large pecs from working out and less muscle mass? So if you can kind of talk to that, and obviously each situation is a little bit different, but if you've got someone that has worked out a lot, does that make a difference in the procedure?
I don't know that really the muscle mass makes much of a difference in the procedure. I see many men who have a lot of muscle mass who have very little breast tissue, but then many men with a muscle mass and a lot of breast tissue. So I don't think that the surgical procedure really varies. You may overall look better if you've been spending a lot of time in the gym than someone who hasn't. But it has more to do with the amount of fat left on the chest wall and the amount of breast tissue that has to be removed rather than whether or not there's bulky muscle.
Good. We've got another gentleman that wrote in, and this may be a similar situation to the young man that you showed that was sort of a more dramatic case there. This individual indicates that they have breast tissue under their armpits, and they're wondering whether you have seen this before or you have experience with this type of procedure there where it might be a little bit unique.
Well, I have to say no, I haven't seen breast tissue in men under the armpit. Now, I know that women can have accessory breast tissue, and I've done breast reductions in women where I've seen axillary or armpit tissue that actually bulges out. Now, I assume that could be possible in men. What I see more commonly in men is excess fat. In men who are middle-aged or maybe overweight, you'll see excess fat that actually extends from the breast around to the side, to the armpit, and even up into the armpit, and can extend up even to the collarbone or clavicle. But that's typically been more fat that can be removed with liposuction. So they still need the breast tissue excised, as I said earlier, but the liposuction typically covers all of that extra tissue.
Very good. And the next question we're going to ask here has to do with their initial engagement and whether they can send in photos to maybe get an initial assessment of things. And Lisa, we might turn that one over to you as the patient consult there. You maybe can kick us off with how that could work.
Well, basically, people that are in the area, they want to come in and meet Dr. Pope regardless. But a lot of times, people that are out of the area, I will have them send in pictures and photos, and Dr. Pope and I will go over the photos together. I will also do a quote for them and email it to them. So that way they're going to know what they're looking at, whether it's going to be toward the 6,200 or toward the 10,000, and that makes it easier for them. Then they don't have to come in to have their first consultation with us, and I try to make it as easy as possible for them. So what I'll do is I will reserve their surgery date. They'll give a $500 deposit, and then I'll set them up the day before so they can come in for their pre-op, because Dr. Pope definitely has to do a pre-op in case you need labs. He's going to want to see what you look like and take photos and things like that.
Yeah, we try to work hard with patients who are flying in from out of state or out of the country to minimize their time away from home, and we do need to keep them here at least 24 hours after the surgery. But Lisa works really hard at coordinating schedules so that they can really get in at the last minute, if you will, for their pre-op visit.
Very good. Thank you for that. And we've got another question. This has to do kind of with remarks, George, that you made earlier about assessing your situation. So we've got a young man who's decided that he would like to go ahead and probably proceed with this, but he's trying to assess the best time to do it, and it has to do with weight loss. He's indicated that he's about 5'9", and he weighs about 235 pounds. He's in his early 30s, and so he's trying to ascertain if he's going to lose some weight, how much would be kind of that ideal point for him to start saying, okay, I'm ready to go to that next step. Or is this something at this point, and I know it's just kind of some quick numbers out there, so each situation being a little bit different, but what advice might you give to someone that's thinking about trying to lose a little bit of weight before doing this?
Well, I always say, as I mentioned earlier, it's great to be in ideal physical shape for any surgery, and it would be great to get to your ideal body weight prior to surgery. And I really try to encourage patients to do that. But then, unfortunately, reality sinks in, and someone who's 33 might have a couple of children and a wife and a full-time job, and maybe has trouble having the time to get to the gym, or doesn't have time to eat properly and just can't get the weight off. And I showed you kind of an extreme case with this young man who's only 17, but he was sort of in dire straits emotionally. And I think you have to take the whole picture into consideration, and that was the case with that young man. So I guess the answer to the question is try your best to get your weight down. You're going to heal more quickly. You're going to have a better result if you're closer to an ideal body weight. But if you can at least get close to that and can't quite achieve it, you're going to be better off.
Very good. And I just want to address, a number of folks did write in relative to price early on in the session. I think Lisa's done a very good job of outlining that, so hopefully we've addressed your questions there. However, if you do have some more specific ones, please feel free to send them through the chat. And while we might not address them verbally on here, the team will be happy to follow up behind the scenes with you on any questions you have there. We're probably going to have time for about 2 more questions before we wrap things up here. I would like to pose this question out there, which centers around reoccurrence of the underlying factors. And so the basic question is, once you've had this surgery, is there a risk of it coming back after surgery if it's caused by hormones or some other internal conditions? So can you speak a little bit to that for us?
Sure, and that's a really good question. I'm sorry I didn't bring it up before, but that's a good question. Thank you for whoever sent that in. What we often see is growth of scar tissue that can form, and there's unfortunately no way to predict who's going to develop scar tissue and who's not in the surgical site. I think it's more commonly found in situations where maybe someone bled a little bit, had some oozing of tissue, oozing of fluid into the surgical site, or maybe they didn't wear compression vests long enough or diligently enough. And that can usually be addressed with injection of steroid chemical into the scar tissue to melt it away, just like you might inject a steroid chemical into an external scar to shrink it down. But regrowth is always possible. It doesn't happen often. I mean, you try to get all of the breast tissue out. I think in situations like this, if you're going to see it more commonly in younger people who have maybe a hormonal imbalance who may develop regrowth, similar to a woman who has breast reduction surgery at a very young age, but she can tend to have, because of hormonal fluctuation in puberty, may have regrowth of that tissue as well.
Great. We do have one more question I'd like to get to, and then we have a short video clip that we'll leave you all with. But this person is asking, how often have you done procedures that involve excisions? So, and hopefully I've said that correctly.
Excisions only. I assume you mean excisions only. Fairly common. They're fairly common. I mean, most people come in and they have a more significant problem. I showed the one gentleman who had was a bodybuilder who had only tissue behind the nipple areola. Another young man recently operated on comes to mind who only had, say, like a quarter size of breast tissue, and that can be done under local anesthesia in the office. I know Lisa shared with you some numbers that might sound a little bit ominous, but we certainly adjust the fee based on the severity of the case. And if it's purely excision, particularly under local, I mean, then you're not really talking about very much, but that does come up from time to time.
Great. Well, any final thoughts, Dr. Pope, before we push out that clip and let our folks go for the evening?
No, I just want to thank everyone once again for registering. This has been great, very exciting for us. It's our first webinar, and gynecomastia is something that I really feel very strongly about, and it's something I really enjoy working on. And I want to thank everyone who registered, and hope you will do your due diligence and your homework to find the best plastic surgeon for you. Very
good. And ladies and gentlemen, we will stay online, so if you'd like to send us messages in the chat area, please feel free to do so. We will respond to those if we have some time, but the team can certainly follow up with those of you that have indicated that it is okay for us to do so. There is a survey as you exit the session area that we'd ask you to give us a few comments and thoughts on before we do our next webinar. Lisa, we'll turn it over to you for some final comments.
Yeah, I just really want to tell all the guys out there that 1 out of 4 men suffer from this condition, and it is nothing to be embarrassed about. I do get a lot of phone calls to where I will ask what type of surgery. The person does not want to say what type of surgery until I say it, and this is really nothing to be embarrassed about. It's very common.
Thank you for those final thoughts, Lisa, and with that, we wish you all a good evening.